Hello everyone, my name is Shannon Gold and I am a co-occurring counselor here at Pinnacle Treatment Center in Pemberton, New Jersey. My focus is the mental health side of things. Mental health, even in 2025, is still a stigma. Granted, in 2025, we know a lot more about mental health than we did back in 1925, but as human beings, we're still a work in progress. Not just in Mental Health Awareness Month, but in all the months of the year, we should be prioritizing mental health, anxiety, depression, autism spectrum disorder, schizophrenia. A lot of these mental health concerns, while we understand them a lot more than we did then, we still don't know everything about it. Not necessarily causes and treatments, but just the stigma of everything. Even seeing somebody like myself, because you have social anxiety, oh, you're going to see a therapist, you might be crazy. Yet it's not so much a stigma when you go to see a medical professional because you have something going on with your body. Same concept, different parts, same concept. It's similar to a vehicle, right? You see a check engine light, and we can only ignore that check engine light for so long until we hear something going on in our car. Then we have to take it to the mechanic. There's not so much a stigma taking a car to the mechanic or going to see your doctor because something's going on. Your brain is just as important too. And there are many different treatments for many different things and different approaches. Not every approach works for one client. One of the unique certifications that I have is called a Certified Therapeutic Game Master. Long story short, I'm a huge nerd and I play Dungeons and Dragons. So with that certification, I can incorporate Dungeons and Dragons in a therapeutic setting. How does that benefit the client? Well, if you're speaking to somebody like myself in the regular talk therapy, right? Tell me more about this. Many clients don't feel comfortable talking about themselves, especially if they're talking to somebody like myself whom they've never met before. So if they play a character, that takes their mind off of what they want to work on, and they're actually working on it through what we call play therapy. We can give coping skills and worksheets, and the client may not be able to practice that once they leave here. So the coping skills are the what, and what I use is the how. It's one of many unique approaches, since many clients are unique. And as I said, not every theoretical model works for every client. Sometimes there are a multitude of different theoretical approaches, like motivational interviewing, rational emotive behavioral therapy, but that's beside the point. This Mental Health Awareness Month, let's speak about the importance of getting mental health treatment. Let's lessen the stigma. Dr. Carl Rogers, person-centered therapy, right? Let's change the language. If you could change the language, you can change the perception. Instead of saying schizophrenic, autistic, somebody with schizophrenia, somebody with autism, somebody with anxiety. Because at the end of the day, clients and human beings should not be defined by the disease that they have, but rather than the individual that they are. So change the language, change the perception. Have a happy and healthy May. Enjoy your Memorial Day weekend, and let's bring awareness to mental health, not only this month, but every month. Take care.